Next, I'd like to introduce Shiyi Zan, who is a research analyst at Partners Healthcare Center, Partners Healthcare Center for Connected Health in Boston. I don't know if this says it on your business card or not, but I actually prefer your other official title, the Connected Health Protege. So in any event, she's going to be talking about her exploration of social media for adolescent and young adult healthcare.
Thank you, Kevin. Hi, everyone. It's an honor to be with you today. And so I'm speaking about, so just before I get into the presentation, I just want to show of hands, how many of you are healthcare providers to an adolescent or young adult population? And how many of you have a family member who's an adolescent or young adult? And how many of you are under 25? Good. So the topic is AYAs, is adolescent and young adults. And a lot of the morbidity and mortality in this population is as a result of health risk behaviors and also poorly managed chronic conditions. And we know that 95% of this population is online, and then over 80% we know use social media, and actually 2/3 of this population use social media more than once a day. So it's where they reside, and a term that is used for this population is digital natives. So the purpose of the study that we did is a review of the literature on what has, so where have we been? So what has been done in terms of research on adolescents and the use of social media to engage them in their health. And then where do we go from here? So any gaps in literature that we can identify and make sort of, not recommendations, but I guess recommendations on where there is more need for research and how that applies to healthcare practice. So I'm not going to go too much detail into the methods. If you have any questions, I'm happy to speak to you about it afterwards. So this is an abbreviated flow diagram. So we did the study using PRISMA guidelines for systematic review. And so, we identified studies through Medline, PubMed, using the search terms for social media, anything related to social media, including, Web 2.0, specific social media keywords like Facebook, Twitter, whatnot, and then also adolescent and young adult keywords, including, adolescent, teen, children, things like that. And then we found 285 studies. We excluded 201 because some of them were not original research. Some of them were not within our age range of 11 to 25. And then, some of them were not, had nothing to do with social media or online social networks. And then, one did not have anything to do with health. And then we included 84 studies in our review. So very quickly, just to give you a breakdown of by year. So we looked at articles between 2002 and 2013 when we did the study, partway through until October 1st, 2013. And we chose 2002 because that is commonly known as when social media was popularized. And then, so as you can see, there's only 2 studies that have been done prior to 2007. And most of the studies, 29 studies, were done in 2012. In terms of the breakdown by age, so 60% were 19 to 25. And we included this age group. Initially, we wanted to look at just adolescents and teenagers, but we included this age group because a lot of the health themes sort of were applicable to everyone from 11 to 25. And then unspecified age is just if they mention it was unspecified adolescent age. So this is the breakdown of studies. So we classified them based on methodology, by the type of social networking site or social media used, and then also by the health content. So as you can see, the majority of studies were observational studies. And then the most common single social media platform that was studied was Facebook. And mixed social networking site is, it could be using more than 1 or 2 platforms. And then the health content, high-risk sexual health behaviors, and closely followed by alcohol, tobacco, and other drug use, and mental health. Those were the most common themes. And then, so we came up with primary categorizations for studies. So for every study, we evaluated it and summarized it. And also, we had this sort of primary categorization based off of Moorhead and colleagues' systematic review on the use of social media for healthcare communication from 2013, published in Journal of Medical Internet Research. And so we had these 4 categories. So the first one is observing adolescent and young adult health behaviors. The second is providing health information using social media platforms. The third is engaging adolescents and young adults. And then the fourth is using social media platforms for research study recruitment. So those were our sort of common categorization themes. So I'll be going through, and giving you a summary of them. So in terms of observing health behaviors, social media platforms and how adolescents use them offer a window into their lives. This population is under a lot of influence from their peers, and so normalization of health risk behaviors was something very common that we saw. So the example is with alcohol references on social media and social networking sites. There's also an opportunity for support around mental health. So mental health was another one of the top categories. And we found that 50% of high school students experience the need for mental health support, and 47% believe that social media could help. But so this population sometimes wants help, but they don't know how or where to seek the help. So it offers an opportunity for healthcare providers to be able to look at what they are displaying, and then be able to intervene in a timely way. So the second category, providing health information. So teens, adolescents, young adults, they want information that is personalized. I think most of us do. And they also want to know that they remain anonymous, and that the person who they're getting the information from is a credible source. So they want to know who you are, and that you're a pediatrician or a credible source, but they don't want you to know who they are. So they want to remain anonymous when they're speaking to you about things like topics like sexual health. And then the third category, engaging this population. So it's a potential gold mine. So there's a lot of potential to engage this population on social media and social networking sites because it's where they reside. They're digital natives. They're almost born with smartphones. So this is a prime area to be able to reach them and engage them around their health. But as you've seen, there's not very many studies that have been done in this area. Most of the studies have been observational, and for good reason, because the studies that have been done that have been interventional have experienced a lot of, so there's been mixed results because they've experienced issues around engagement. So, you know, for a study where they created a social networking sites for patients and families with type 1 diabetes, the feedback that they got was that login was a problem. Patients didn't want to keep logging in all the time. Information wasn't updated very regularly, so it wasn't engaging. And people just fell off after a while, and they stopped engaging with it. And that's actually something that we've seen in a study that we're currently working on as well. And then also, adolescent and young adult patients with chronic illnesses may be hesitant to discuss their disease as they don't want to identify as being sick. And so that is another reason why they might not engage online. In terms of research recruitment, this has been a more definitely an up-and-coming area, and it's definitely a new way to do research that has great potential. So social media offers a way to reach a variety of populations, especially those that can be difficult to reach, those that are traditionally underrepresented in research. And then there's been studies that we looked at which were able to reach people who would have otherwise been lost to follow-up. For longitudinal studies. And then also, you know, it's great for collecting timely data. Social media is real time, so you can tailor the way that your ads might appear, for example, to recruit certain populations that you might need more numbers on. And then also, compared to traditional recruitment methods, it can be a lot more cost effective. So, you know, there's no issues with travel. You don't, in terms of compensating patients for their time in coming to the clinic for travel or you know, other things. It can be much more cost effective. So in terms of conclusions and future directions, you know, social media offers a way for providers to engage with this population where they reside. So on social media, on the internet. And then by understanding how this population engages with and consumes information on these social media platforms, we can improve upon current engagement strategies. So as you've seen, there's been a lot of studies that have been observational, and this is a great first step. You know, studies that have been done, clearly, interventional studies have experienced difficulties because researchers might not have been prepared. And, you know, for example, the amount of time it takes to keep, you know, a social networking site updated is a lot more time than you might think. Posting frequency and things like that have to be considered. And then, you know, social media is becoming increasingly real-time, immediate and local with the advent of mobile technology. And so this facilitates proactive healthcare delivery. So the ability to understand adolescent and young adult behaviors and daily habits allows providers to be able to intervene with relevant and timely messaging and coaching when it's necessary. And so, you know, we know that this population is on social media, and they are greatly influenced by social media. And so there's a lot of potential to use this to engage them around their health. And that's why we did the study, and that's why I hope that this will continue to make progress as well. So thank you. Questions? Yes. Mm-hmm. We did that, and I didn't cover it in this presentation because there's a lot about methodology. I'm happy to speak to you about the limitations of studies, and so we had a checklist that we looked at for limitations and biases in studies. Yeah. Mhm. Mhm. Yeah, so we chose not to do a meta-analysis because it's great that you brought this up because I sort of didn't mention it, but we were more interested in what was out there and not the effect of social media on their health. That would definitely, we thought of doing that, we did, but there really wasn't enough out there to be able to do a meta-analysis. So we just did a descriptive review. So I can tell you when we, for our search terms, when we did social media, and then without including like adolescent and young adult population, there were about over 1,600 articles. And then when we included this population, it was 285. And so myself and my Dr. Yonker, my co-author, she and I both reviewed the full text of 285 articles. And we wanted to do that just to make sure, for example, one of our search terms for the adolescent and young adult population was children. And we didn't want to miss out on studies that we would have missed if we didn't include the search term like children. But I mean, that would be, if I were tech savvy enough, maybe that, that could be a way to do it the next time. Any other questions?
I'll ask one.
Yeah.
So, did you, for your group, thought about the items in terms of mental health and some of the stigmas that looked at approaches to kind of that stigma? Sites in the study to kind of reduce approaches that could be done, or studies that looked at methods to do that?
Yes. So the short answer is yes. In terms of a good example,
I can get in the queue and follow up afterwards.
yeah. So I can't really give you an example right now. So we did come across some interventional studies. Did you say mental health or?
Yeah, just mental health or anything. It's really the focus on sort of the stigma associated with it. So were there studies where they looked at ways, that aspect of it, to make it welcoming, or ways where platforms, despite the fact
that one example that I think of is organ donation. So there was just a study that comes to mind is around organ donation and how they try to use different social media channels to communicate, what it meant to be an organ donor, and they ended up being able to engage more people in signing up for organ donation registries. So, and if I think there are more recent studies that have been done as well. So I'd be happy to speak to you further. Thank you.